Welcome to the Humble Hoof Podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com.
Trying to choose the right supplements for the right horses often feels like a chore, and you have enough chores as it is. Fortunately, there's Equithrive, whose mission is to make this whole nutrition equation easier on you and much more beneficial to your horses. Equithrive's lineup of pelleted supplements are developed with care, backed by science, and a 100% satisfaction guarantee. Not to mention picky eater approved. Whether you need advanced joint care for your equine athlete, gut, or metabolic support, Equithrive is your one-stop shop for feed tub fortification. Do your horses and yourself a favor and visit equithrive.com. Use the promo code HumbleHoof and get 20% off your first order, plus free and fast shipping nationwide. Don't forget to use HumbleHoof, all one word, to get 20% off your first order at equithrive.com.
A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 20% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 20% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. I've been convinced for some time that there is a connection between gut health and hoof health. I mean, if a horse's gut isn't functioning properly, how are they going to thrive in any area of their health, let alone their feet? I reached out to Dr. Ethan Romas-Hill, who is a veterinarian who spends a lot of time on gut health in Australia, because he actually works on hooves too. He does a lot of hoof care. I've seen his videos on TikTok, and I see that he has a lot of sound, comfortable, barefoot horses. And I wanted to see if he saw a connection between the gut and hooves, and he agreed to chat with me about it. So usually the first question I start with for everyone is, well, I mean, obviously for veterinarians, is if you would be willing to tell us a little bit about how you became interested or your journey into veterinary medicine, and also your interest in hoof care, if you're willing to kind of chat about that.
Yeah, absolutely. So I've been one to sort of grow up on the back of a horse, like a lot of us. And I've, I guess, started with hoof care at a fairly young age. I've sort of always, in some capacity, trimmed and shod my own horses and horses of my friends, and then rode through dressage through my teenage years and decided that I wanted to do a bit more with horses and make my life built around horses. So be a vet it was. Went off to vet school, wasn't sure if I wanted to really continue with horses, had the conversation in my head a lot, do I do small animals, do I do large animals, because that's sort of how our system is over here. And really had horses throughout that time myself, and had friends' horses that suffered in two areas. And I could see through competition riding that there were two big areas above all else that were the main reasons why someone maybe couldn't take their horse to a competition, or they had to have time off, or, where were they spending their money? Where was the big pain points for horse owners? And that wasn't an opportunity to say, hey, that's where I'm going to send a business and make money there. But for me as a horse owner and a horse lover, and really an educator in a lot of ways, I needed to find the big areas where we could improve. And I think everyone would agree that top of that list is usually nutrition.
Yeah.
And second on that list is, I guess, hoof health in every aspect. So while I have done some time as a small animal vet and in sort of more in the orthopedic surgery area, that led me back into sporting dogs and found my way back into sporting horses. Throughout that time, I guess, how did I get into gut health? I actually had a horse several years ago now that he was an imported horse that I bought after he had been imported to Australia from the Netherlands. And he had all these weird signs that we understand so much better these days. But to summarize it, he should have been a superstar and was throwing people off into the wall, breaking their spines. So I picked him up very, very cheap. He still looked good. But you could tell there was something not quite right. I had him for a week and he tried to throw me off into a wall. I scoped him and found still to date, the most severe ulcers I've ever seen in a horse, full stop. And at this stage, really we'd have the conversation, but it's not the same conversation we're having today. Like, I feel every horse owner really understands ulcers quite well, no matter where you are in the world. There's some places that understand better than others, but it's about sharing that education around. But at this point in time, that was still fairly new in these sportier horses. So that's where the spark for me came through gut health. Later down the track, I've had horses that, I've got one horse currently competing at advanced dressage levels, sort of training Prix St. George now, should start in our spring at Prix St. George. And he was one that I was basically told, this is probably navicular, retire him, he's never going to come good from this, you'll have to keep him shod and blah, blah, blah. At this point, I was working with feet quite a bit, and this was getting a second opinion because I didn't trust myself at that stage, especially when it's your own horse. To cut a very long story short, that horse is obviously now competing advanced Prix St. George level, or about to go Prix St. George, and he doesn't wear shoes and has probably the best feet and the soundest feet of any horse that I put hands on. So, I look back to my own educated thoughts around both gut health and hoof health, and I felt trapped in a corner where I couldn't do anything. And I don't like that feeling. I don't want anyone else to have to feel that way. And so that's sort of where I've found my life's purpose and directed my life towards, is learning as much about these two areas, as well as general horse management and dressage principles, training of horses. I've directed my life towards finding out as much as I can and sharing that information. It's a bit of a long-winded way, but I think when you understand the why behind doing something, the how becomes easy. And I really try and align strongly with that purpose.
Yeah, and a few things that you said really hit home for me. And I feel like there are two hills that I kind of die on. And one is that there has to be a connection between nutrition and the hoof. And also the second thing that you mentioned, which I am so incredibly passionate about, is that a lot of horses that are diagnosed with hoof issues like navicular might not actually have pain stemming from their feet or from, the navicular region. It could be their feet hurt, but it doesn't necessarily mean that it's just this degenerative disease. And we have to look at what else might be going on in the body, or their management, or their diet, or their gut, or things like that, to make sure that we're not missing the mark. And so I'm super excited to be talking to you about that, because there's things that I'm super passionate about. And can you remind me where your practice is based out of?
So I'm based out of sort of surrounding Melbourne and surrounding Sydney. I sort of work between the two in Australia.
Awesome. Yeah, so it's quite the time difference. Thanks for putting up with that when we're figuring out a time to chat.
That's okay. It's a fairly reasonable time here right now.
Yeah. Okay, good. Yeah. And so something that, I kind of wanted to focus on today in our conversation is gut health. And I've been wanting to do a podcast episode about this for a very long time, but I feel like I know so little about it that it makes it hard to kind of have an educated conversation. So I might have to have you sort of help me with that in terms of the direction of some of these questions and things like that. But I guess to start off, what are some of the most common issues that you see in horses in regards to their gut? Obviously, you mentioned ulcers before. Is that pretty widespread across the board?
I think it depends where you are, what we'll focus on, really. And the conversation you have regionally depends on the level of education and the level of intervention that's already been made. So in some spaces, we'll talk more about ulcers, but then you've got other spaces, especially where there's a lot of competition, where people will control this, and I'm going to put this in asterisks, really well with drugs like omeprazole, which I don't know what your brand names over there are. It'll be something UlcerGuard, Ulcer Shield, things like that. And that will pretty reliably keep ulcers at bay. So that's obviously a big issue for us. And those drugs controlled that quite well. Other drugs like misoprostol and sucralfate will help there. But I think it's so important to realize that you're talking about an organ that has maybe 15-litre capacity in an average horse. And then behind that, there's another 75 litres of capacity and surface area where there's so much functionality and so much life in the horse. And we're talking about this one little bit at the start. And more specifically, we're actually often only talking about, a band around the stomach that is about 3 centimeters max wide where they're likely to get ulcers. So when you put it into perspective like that, the ulcer conversation feels really small. Can it produce massive issues? Absolutely it can. But if we're only controlling that one area of the gut with these specific drugs, I'll admit sucralfate does coat all the way through. It is quite a good drug. But when we talk about omeprazole, we're talking about just protecting this one little tiny region and thinking that that means that our horse's entire gut is healthy. And it's just not what we know anymore. So this is what I mean when we talk about things a bit different depending on the region. Australia, I can speak of more so, is quite ahead in understanding of gut health, which is fantastic. So we think a lot about the hindgut now. So, and I guess the dietary changes, the why behind omeprazole. I don't know how familiar you are with the dosing schedule for it, but usually most preparations will be about 360 milligrams per mil here. From what I understand in the States, it's quite easy to access. It's not very easy to access over here. I think it's a lower concentration over there. So, but usually it'll be, about 2 to 4 milligrams per kilogram for 28 days. That's a pretty standard protocol. And what you see frequently is horse owners that will do the 28 days and maybe taper off or stop, make no other changes in that time, and then they're back on the medication again in a month down the track. And the horses often look quite good, but when you go and look at the longer term, more complex structures like feet, you'll say, oh, but his coat's fine. Why is his feet so brittle? Why do his feet not grow? But we've sort of had this effective system now of masking this in such a way that we are neglecting the true gut health of things. So as a general comment on this, that if anyone listening takes away absolutely nothing else from this, it's that omeprazole was never designed to be a long-term treatment. Really, it's not a disease to me. I guess it is because it's functional, but I treat it like an injury. Mm. If you think of the horse's body as a continuous tube and their gut continues with their skin, you think of it as this one big protective immune organ that separates the outside environment from the inside environment. And so if you had a cut on your skin or an ulcer on your skin, you're not going to think of it as a disease necessarily, especially if it's related to, people who get psoriasis from milk. If it's a reaction to something you're eating and you get an ulcer on your skin, you are not going to call it a disease. You're not going to eat that thing anymore, right? That skin is continuous with the gut. An ulcer is an injury. You don't treat an injury with a long-term course of chemotherapy, which is what omeprazole is. It protects, it controls the dysfunction of over-acid production in that time, that 28-day period. So you've got time to make the changes that you need to be able to have that horse go on and thrive with a healthy gut. Does that make sense?
Yeah. So you're basically saying, it's treating the symptom at that point, but it's not addressing the cause of what led you there.
Absolutely. But the question that then comes is, what the hell do we do?
Yeah. Yeah. So I guess another question, because I mean, obviously we're talking about omeprazole, and this is just kind of like maybe off topic, but I know in people, omeprazole can cause, other issues. I know that it can affect like B12 absorption or other nutrient absorption. Is that true in horses too, or is that strictly like a human issue?
So in humans, I think they refer to it as the divorce maker because one, it can produce quite a bit of gassiness. I think anecdotally, there's behavioural changes in horses with the use of omeprazole. It's not something that I would consider extremely significant, but it's in my mind. The really big thing that I consider with omeprazole is it's quite potent at chelating calcium or binding calcium. Calcium needs to exist in a certain form to be able to be absorbed. So while that's maybe, unless you're giving it long-term to an adult horse, I'm more concerned there with your young growing horses. So I see plenty of maybe futurity horses that people are thinking they're doing the right thing with because they want to take them to competitions and protect them during travel. And yes, you will protect the stomach during travel. You won't necessarily protect the whole gut, but also you've got this calcium binding in an animal that's actively growing and trying very hard to bind calcium together in such a way that they can build bones, right? And this starts to come into feet a bit. If we look at quarter horses are probably overrepresented in navicular. This is feel free to disagree with me there, but that's just my understanding from what we have in Australia. You've got small upright feet and big bodies, and especially if they start to go negative, you're going to see more navicular signs, of course.
Absolutely.
But then I think these horses often go out and are on a lot of omeprazole early. It's not just quarter horses across the board, but horses are on omeprazole really, really early. And then we have problems with a specific bone in their foot having calcification problems. That's a link that I've made, not based off on any research, but it starts to make you think a bit more. Where are we pulling calcium from? Where is it needed? You'll start to see an increase in things like pathological fractures, these tiny repeat injury fractures in racehorses. The racehorse industry in Australia is very big. We see lots of 2-year-old, 3-year-old horses with a lot of pressure on their bones that aren't completely calcified. They are fed really, really high cereal grain diets, and the only way that they can be controlled from getting foregut ulcers, stomach ulcers, is with lots of omeprazole constantly. The soundness rate of retired racehorses with anything from subchondral bone disease like your osteochondrosis, your OCD lesions, is well and truly overrepresented in these adult horses. Is it genetic? Is it from early trauma in these bones? Is it from calcium homeostasis issues? I don't know. But to me, having something that's going to bind such an essential macromineral that is used in pretty much every muscle function in the body, it's the reason that your nerves can relax, I guess, can reduce their excitability. It's the main electrolyte that's used to allow your heart to pump, and we're binding it for the smallest percentage of the horse's gut. So I'm not saying don't use omeprazole, but there is a cost to everything that we do with drugs, and they're usually to achieve a fast result. I know horses that have passed away from ulcers, and they needed, probably at the right time, omeprazole to really help them. So I'm definitely not saying don't use it. I'm an advocate of it in a lot of spaces, but I'm not an advocate for the use of any long-term chemotherapy. Let's not forget, we're using chemicals to change a horse's body function. This is chemotherapy. Long-term chemotherapy to manage something that is not truly a disease. It is a side effect of less than perfect, I'll say, less than perfect management. And really, I strongly believe that the true cure, for lack of a better word, is education on how to better manage our horses and having a better understanding of stress in horses.
Yeah, absolutely. And I want to ask you about that, like the causes and what you see kind of leading to these gut issues. But I want to also mention that, you were talking about hoof issues and navicular and things like that. Something that made me kind of like latch on to the idea of gut health is that there's like little pockets of groups that are starting to talk about gut health and its link to laminitis and hoof sensitivity and lamina connection. And I mean, I think I've always kind of assumed that if the gut isn't healthy, they're not going to be absorbing their vitamins, minerals, nutrients well, possibly. And I could see why that would affect the feet. But something that really intrigued me were people who still now are swearing up and down that if the gut is not healthy, then these horses, especially horses that are predisposed to metabolic issues, are more likely to have laminitic episodes. And so that's something where I've really wanted to kind of see if there's, maybe, we don't have any research on this. Maybe there isn't a true correlation, but I don't think it can hurt to have a healthy gut either way.
I think I'd love to be able to cite some research specifically, but there certainly is research that links this. And I don't think it's a bad thing to use case studies and anecdotal research here, anecdotal evidence here, because there are so many horses that get laminitis, and there's so many horses with various gut issues that you can see really strong correlations even with anecdotal evidence. It's really, really hard to do, especially longitudinal studies, but any study you do in horses, I can tell you from experience, is very, very hard to control. So sometimes anecdotal evidence, and a lot of it, is really, really valuable. The reason it's really hard to do research in horses is unless you own, say, 50 horses and you feed them all yourself, or you have one research assistant feeding them all yourself, compliance is really, really hard. If you're trying to take bloods from horses, their stress levels throw out all of your data. So sometimes seeing, and environmental factors, if you don't own them, they're in different places and you're not seeing them every day. It's really, really hard to control. I've done some research into metabolism in horses, but by the end, when you're trying to come up to these horses with needles, they get this instantaneous spike in glucose, which is obviously going to result in a slightly delayed insulin boost. When we're measuring insulin, just because they're stressed because they don't want to be poked with a needle, it's really, really, really hard. So that's just a bit of a preamble there. But the other thing that we can pretty consistently see is horses that are thriving. If you looked at a horse and said, that horse is thriving, with a certain degree of accuracy, you're going to be able to predict how likely that horse is to have any disease, let alone hoof disease. And I think that the link that you're looking for here is what are the things that help a hoof stay together? So with any tissue in the body, you've got the structure. So we've got proteins really are what's making up us because we don't have a cell wall. So we have these proteins and we need something to hold them together with, and that's energy. So that applies to every single tissue in the body. And then we have things that will strengthen those connections and weaken them. That's something that I'll come back to in a minute. And this bit sounds a little bit touchy-feely, but we've got sort of 3 reliable ways that we can get energy into the body of a horse. They can take the energy from the ground, which we care about as hoof care professionals. Sounds very silly, but when a horse moves, that ground reaction force is actually taking the Earth's potential kinetic energy that it has in it, and they then use that to move. So the only connection with the horse to the ground is through their feet, obviously, and that's a big energy source. So that's why we care so much about feet. We've got the sun. I can't control much of the sun, so I won't talk about that. But then we have the digestive tract. So you're starting to get this link straight away with the gut and the feet. They are so intimately linked. They are 2 of the huge avenues of energy into the body. So if we don't have a gut that can effectively absorb these proteins, like you said, we don't have what we need to build the hoof. That's things like we talk about proteins like methionine all the time, lysine, these really important known amino acids in producing hoof tissue. We can research this on on cadavers, we can use histological slides looking for these amino acids effectively. I'm no pathologist. I don't know how they find that, but they can isolate these specific proteins. And the horses that are having a less high likelihood of disease, don't have clinically apparent disease, have higher proportions of certain things than those that do. That's an oversimplification, but that's how we understand it. So if you've got an ineffective gut that can't take in proteins properly, your ingredients list is already tainted. Then I've said now we've had 2 of the 3 energy routes into the body explained. Then we've got the gut. If the gut can't effectively produce energy and can't effectively absorb energy, how are we meant to put through any energy and protein into building feet? And that's sort of the metabolic digestive function of the gut. But like I was saying before, the gut is one massive immune organ. It's up to 70% of the immune system can be in the horse's gut. So when you think of the immune system, a lot of people think, oh, that protects me from getting sick. The immune system encompasses all of the body's protective mechanisms, and a lot of that is built up from white blood cells, which are our inflammatory cells. They include our inflammatory mediators. So when you say that, if we phrased it differently, that the capacity to produce inflammation, 70% of the body's ability to do that is found in the gut.
Wow.
And we're talking about laminitis being an inflammatory condition. Do I know for a fact that that's linked? I would like to think I do, but I can't put that down on a piece of paper very clearly. But if we've got this massive vessel of inflammation, it just makes sense that we start to have this, what I call like the glass almost full model versus the glass half full model, whereas a horse with moderate levels of gut inflammation needs quite a bit to push it over the edge in all of its other cells, because all of these inflammatory cells are cycling through the entire body. Then you get these horses that have high levels of basal inflammation because one of the biggest organs in their body, their gut, if not the biggest, is inflamed. So they only need this tiny little shift to throw off all of the immune system in their body towards inflammation. And because it's communicating through the blood, if you've got inflammation in one spot, it all goes to the heart and gets recycled, right? It's going everywhere. So I could talk about that on and on and on, but I hope that that's just a little bit of a taste to start with of why it's so important, why it's linked to so many things, and why it feels like the root of all evil is poor gut health in horses. And I truly believe that it is the place that we need to start. It really doesn't matter what the condition is. If your gut is compromised, you need to start there if you can, and it's not a true emergency. But long-term health in horses is dependent on their gut health. That's a phrase I'm happy to be quoted on. That is how strongly I believe that.
Yeah, absolutely. And honestly, I think it's a missing link in some cases that I'm working on. Having a hoof rehab facility, one main focus of ours is forage. I want the horses here to have safe, tested forage available 24/7 without the risk of becoming obese. I've spent years looking for the ideal slow feeder for us, and we have found it with Hay Boss feeders. When I tell you that my Hay Boss XL feeder has cut my feeding time by 90%, I mean it, and it might even be an understatement. The covered feeders with integrated slow feed nets allow for all my horses here to have access to hay all the time, which is healthy for their guts and minds. They're also not able to completely binge all at once, because the nets keep them in check. They're available all over North America right now, but side note, if you're in New England, I got mine from Mountain Lane Farm, who delivered it right to me and showed us how to set it up and use it. We can't imagine our lives without it here. And so I guess, back to that question from a little bit ago, what do you see as some causes for gut issues? Like if ulcers or things like that are a symptom, what is leading up to that insult or injury?
I think that there's an undeniable genetic link for some of these horses, and that's pretty much all I'll say there. Some of them have more of potential to produce more acid, need more help with their gut. They don't cope as well with what we feed them. That's because I said I wouldn't say anymore, but really we've halted evolution in horses. We're talking about a really old species that we have had for, maybe 5% of their existence, if that, in domestication. And then we've made them completely adapt to our systems without letting them evolve. And the way we've allowed them to adapt is by selectively breeding horses that don't show us their stress in a clinical way. So we have learned that if a horse is stressed, they need to be anxious. And that is the biggest problem, whether you're a trainer, whether you're a vet, whether you're a hoof care professional, whether you're a stablehand, that is the biggest problem you will ever face as a horse person, is misunderstanding stress in horses. I promise you, if you truly understand stress in horses, you will have competition success, you'll have healthy feet, you'll have healthy coat, you'll have a horse that colics less, you'll have a horse that gets less laminitis. These are all stressors. And I want to stress that is stressor, stressor. These are stressors, not stresses. That's important. These things that influence their stress levels. So by the time we can see stress in a horse, it's too late. And that's not to say you can't do anything, but it means that a horse's capacity to cope with stress is finite. If you think about the levels of stress that a horse will have to reach before we can see it, that generally tells you how much physical capacity. This could be their own ability to produce buffers, their own pain tolerance, their own ability to produce B vitamins. That is their coping mechanisms for stress. There's a term called allostasis. You're probably familiar with homeostasis, which is, trying to maintain a stable internal environment despite changes in the external environment. Allostasis is closely related, where we want to make changes so that we can maintain homeostasis. That might be, the external environment is changing and the pH in the stomach is dropping. The body allostatically will then want to produce more acid buffer to keep the pH the same within homeostatic levels. So that's the horse's capacity to cope with stress. So anything that changes, I think you'll agree with me, any change in a horse's life can be stressful. This can be something as simple as you've got a different truck of hay that's come and it looks exactly the same, but the horse's gut is stressed by it because it's slightly different. Everything can stress the horse, but they have a capacity to cope with it. And when we push them beyond that, that's when the overarching diseases of the gut, diseases of the feet, to some description, metabolic diseases, endotoxic diseases, they then start to show their head because the horse can't cope with them anymore. When we come back to things like your B vitamins, you've also got most of the horse's serotonin in the gut. So that's when we start to see B vitamins and serotonin. Potentially the serotonin model is not extensively researched, but it's a nice idea to think of, because we see horses with gut problems that show us more signs of behavioral stress, anxiety. But if you take it back and you fix all their gut problems, you don't see it as much. That's an undeniable link for me. So when we start to understand stress, we don't have this magic, you need to feed your horse more of this, you need to feed your horse more of this. We need to do everything we can to, one, reduce the stress on the horse, and two, bolster their ability to cope. So that's where your real diet and management practices come in and change your whole way of thinking about things. Any competition rider knows that you can have a horse that can go around and do a perfect test at home and take them out to a competition and they do terribly. Why? How does travel affect them? How does change on feed affect them? How does change in the chlorination of the water that they're drinking at the competition? How does being in a stable when they're used to being in a pasture affect them? These things. And the overarching term for all of those changes is stress. And that stress is physical with us and with the horse. So it's a really cool way of thinking about it. And I guess I've sort of danced around your question a bit of what causes these, because when you understand stress, you can see that it doesn't really matter what the direct cause is. The causes probably come from some sort of stressor. So we'll jump to ulcers now. The horse's gut is constantly producing acid. That's normal. That's what the horse's gut should do. They need acid to be able to effectively break down things that we can't. And because of the way that a horse digests, that they ferment after their true stomach, opposed to a cow who uses their true stomach after their fermentation, horses need to absorb and digest a lot of protein in the early gut. And now I'm going down a rabbit hole. A cow will ferment, produce microbial protein through that fermentation process. So basically, they're growing these microbes and then they digest them. They're pulling these microbes apart and taking their protein and taking the energy source and taking the postbiotics that they produce. A horse, on the other hand, needs really high quality protein that they can digest effectively with enzymes and acid, because by the time it's gotten to the gut, the hindgut, where the microbes are doing the digestion, those microbes don't get absorbed. They go out the other side. We're more worried about the postbiotics that they're producing. So when you see these horses that may be protein deficient, you'll see them be coprophagic. They will be eating their poo. That's the reason that they do it a lot of the time. It's not a mineral imbalance. A lot of it is just looking for protein because their fecal matter is so high in microbial protein. So it sounds like I'm digressing again, but I will come to a point with this. So if we have this excessive acid production and we're feeding horses in a human or anthropomorphic way, where we feed them maybe once or twice a day in a very concentrated meal, they then have a lot of time where they're not actively digesting complex structures. So this acid actually doesn't get utilized and just sits there. So this horse's stomach is designed to have food in it all the time as a grazing species. And we are then pouring more and more acid in with nothing to do. Of course we're going to get burns when the bottom 2/3 of the stomach are coated with a protective layer, but the top third is not. We empty the stomach, and then what do? We ride them. A wild horse will walk, and then walk. They will run, canter, trot for long distances, but generally they walk and they graze, and they've always got full stomachs. We'll put them on a float with no food for 2 hours, get to a competition, and get on their back. They've had this massive acid production. They have nothing making a mat over the top of this acid layer and splashing on the wall, stopping it from splashing on the walls. It just makes sense. It's a management thing, but I'll come back to the level of stress that this walking horse gets in the wild. That is quite low. Everything we add on top of that is a stressor. So it's sort of painting this picture that everything we change in horses, they're not really that good at coping with, especially if we are then not protecting their gut with what it would basically need, which is a food source that suits their way of digesting. So what do? Instead of feeding them more correctly, forage-based diets, constant access to good quality pasture, or that's not suitable for a lot of horses, but good quality forage, low GI, low starch forage is ideal. We instead put medications in them to make them suit us and what we want to do, and fill them full of omeprazole, which, if we're treating ulcers, that's fine. But I'll come back to what we said before about the horses being quite poor at pulling any sort of low quality protein out because of the way they digest. If we suppress acid production, we're actually suppressing the horse's ability to digest feed. And if you do that, recently I saw a horse that had this for 7 years of omeprazole treatment.
Wow.
And his diet was being reduced and reduced and reduced. He was just an unhappy, unhealthy horse with this fantastic owner who's scratching their head because this is what we've been conditioned to do, is fill them full of omeprazole because it makes us feel safe. And I can say that this horse, I'll be releasing a bit of data on this, in 7 years never scoped negative for ulcers until we made the 28-day shift in management and gave it a bit more protection and controlled its stress with a temporary fortification of its ability to cope with stress, which was, we're giving them supplementation. That's not going to have a long-term effect. He scoped for the first time in 7 years negative off omeprazole. Wow. I'm not anti-omeprazole, but I just want people to think and be really judicious with the use of these these chemotherapeutics. So again, I've rambled on there a bit, but it's a really simple but complicated idea. If you take it back to stress all the time, that is the keep it simple, stupid version. Is this stressful for my horse? Is this a stressor? Is this a change? How can I help them to best cope with this so they can continue to function as naturally as possible?
Yeah, and that's something that I try to focus on a lot here is, we have forage available 24/7. We have tested hay available all the time. The horses here we have horses out 24/7. They can choose if they want to be inside. They can choose if they want to be outside. My big thing is like, how can I allow these animals to feel safe and feel like they have all that they need and all the resources they need? And obviously we're saying that people often have to do these management changes in order to get to that spot where the horse is, having less stress in their life. And, what are some other things? Because, I get horses in that come from show barns. They have zero turnout from where they're coming from. So it's honestly a stressor when they move here because all of a sudden they're outside and they're not in an environment they're used to. And as they're adapting, what are some other things that I know you mentioned, like supplementation? And honestly, I'm super interested in that, mostly because I have horses that come in from all different backgrounds and I want to help them through that transition without just like tossing meds at them because they're not my horses. So what are some things that you see as helpful to help their gut adjust to those changes in their lifestyle and environment?
Yeah, so I think that you've hit a good point there that no matter how much we try, horses are not really ever designed to live in our environment. So they always have a degree of stress. And that's going to vary depending on how much we handle them and whatnot. And also, we can't control everything. So, if we get a thunderstorm, if they do have to move barns and stuff, how do we help them? I guess that's what you're asking. And this is my point that I come to with supplementation is in an ideal world, we wouldn't have to supplement horses with anything. Truly, they're very good at producing a lot of the things that they need. But I actually had this conversation with a colleague yesterday and said that some people will get dry skin and some people won't. And you can use nutrition to improve the quality of the skin that's being produced and get a result long term. You can use medications to help this, but sometimes you'll just go and put a bit of moisturizer on it, right? Mm-hmm. And that seems like a very rudimentary thing, but you're supplementing the skin's ability to do its job. When we feed things to horses for a specific purpose, whether that's protection, whether that's trying to feed microbes and whatnot, we are just helping them do something that they're already doing. If it's a good supplement and a functional supplement, that's what it should be aiming to do. I think when we talk about functional supplements versus maybe a nutritional supplement, there's a definite difference there. But I'm more talking about functional supplements right now. So again, come back to stress. What is the stressor? What is that stressor doing? And let's do the opposite of that. And let's make that temporary. So at the risk of, I don't want this to become a product promotion or anything like that, but I can give you an example. Recently, I worked with this horse that was on omeprazole for 7 years. We did a 28-day period in which we shifted its diet across and we tracked its fecal pH across this process, which I actually really like fecal pH because it doesn't tell you specifics, but it tells you a lot about what changes are going on. We know that a fecal pH below about 6.4, the horse will be digesting its own gut wall. We want them to sit, I think the magic number is about 6.85, but anywhere between there and 7.5 I'm pretty comfortable with. So this horse had been on omeprazole for a very long time, and if you look at how omeprazole works, it's very slow to reach its peak concentration, and it's very slow to come down. So tapering off doesn't work with this drug. You actually have to go cold turkey, and you don't see signs for up to 5 days later of an issue because that's when their acid is very much, the drug is gone, and we've got a drug that's long-term suppressed acid. So all of a sudden we get this massive burst of rebound acidosis. So this is a really good example. So there's a product from Poseidon Animal Health called Stress Paste that I use. And I don't want this to be a promotion, but there really isn't anything to replace it. So what we did with this horse is we had a dosing schedule of stress paste. Working off the pharmacokinetics of omeprazole, I made a dosing schedule that allowed for the peak control of acid rebound. Because I've recently been discussing with a specialist from one of the major hospitals, an internist, that they get this really, really bad acid rebound. How do we stop this? And they just don't have an answer. And that's why I have to talk about stress paste here, because I don't know what another answer is. So stress paste is basically a product that's been designed to bolster the horse's ability to cope with stress, because that's a finite resource, remember. I can go through ingredients and whatnot, but that's how I want to hear it. But really, it's better to understand what it offers in this situation. So we're going to use it in this case because it can have a capacity to help strengthen the horse's gut wall, feed the microbiome, support the microbiome, and prevent acid shifts. So we've got an amazing graph where we see the stopping of omeprazole, a slight drop in the fecal pH. Over a 7-day period, I want to add that it never dropped below a pH of 7. And this horse, while on omeprazole, started with a pH of 6.6. So we see this tiny little dip. And then as we get to about 5 days, it tanks. But it never goes below pH of 7. And then comes back up and plateaus and stays almost perfectly around the 7.2, 7.3 mark. And this horse then went to a competition. We put it on a stress-based protocol for that competition, where we strategically use it so it doesn't become an expense, doesn't become a stressor for the horse, doesn't affect them nutritionally long term. It's just an adjunctive treatment, I guess, to give them a bit more. So this horse then went on a float. He's not a good floater, and that's likely due to a long-term discomfort that he had. And now it's a learned behavior. And on the side, horses' situational memory is probably the best of any species. That's why they stimulus generalize. If they've been somewhere that stressed them out, everywhere that looks like that place will then stress them out. This is why plastic bags are scary to horses, because they can look like something else. I'm digressing, but the horse then had a bad floating accident. The float actually had to be dismantled around the horse. And this is, what we'd consider a conventionally sort of anxious horse. We tracked the fecal pH through this whole process conveniently, and he came straight home. And we continued to track it for several days afterwards. There was almost no decrease in gut pH, which is amazing, really. Like, you can have horses that go into a stable and will get ulcers because their acid drops so much the pH drops so much just from that stressor. And we're talking about a horse that's already scared of the float, that's been on the float for 2 hours, and is stuck and doesn't know whether he's going to get out or not. And his body is under that much stress, and still we were able to help him resist the change and protect his gut. Moreover, like I said, that horse had never scoped negative in 7 years. The week later, he went to be scoped, and this beautiful trainer, they rode him there because they're so governed by the fear of poor gut health in this horse, because it ruins everything for them and damages their relationship where she can't enjoy him anymore. She rode him to be scoped, and the horse scoped negative for the first time, and it was off omeprazole, and had just had this severe floating accident. So I can tell you that there are ways that we can increase the horse's ability to cope with stress, which is pretty cool. And so I don't want this to be a product advertisement. This is the things that I know to use and that I trust and that I can put my name as a vet behind. What we did with this horse is we increased his forage from low GI forage sources. We basically reduced him back to feeding him like we would feed a laminitic horse. I feed all horses that way. I don't think that they need any more, and I'll touch on that in a minute. But we put a product called Digestive HP into his diet. So that's sort of your daily version, your daily buffering capacity, your daily amino acids that they need to build the gut wall, your daily postbiotics, which are basically if you think about probiotics are the bacteria, they're the good guys that live in the gut. Prebiotics are like the fertilizer for them, and postbiotics are what they produce. A lot of products have probiotics in them that are on the shelf, and I'll let you decide, but we've got a live organism that's got to survive the production process, has to survive shipment, has to survive the shelf, has to survive your storage, has to survive through a low pH environment of the gut, the foregut, then has to go through the entire digestive process and get to the hindgut, which is a very alkaline environment, and then function there. There are one I can think of that has been shown to have some activity. Most probiotics, in my opinion, and from what I've discerned from the research, most probiotics can't survive that process to function. So digestive HP uses postbiotics. So I always liken this to insulin. When we give people insulin, it's actually insulin that's been specifically created by bacteria designed to produce insulin. That's a postbiotic. So when we put postbiotics in, we are putting the products that we want these good bacteria to be producing in to support them and give them time to return to normal function. The other concern you have about probiotics is there's now very new and emerging research that if you can get probiotics in and they survive through encapsulation or other methods, there may be a strong link to antimicrobial resistance because they transfer DNA within each other. So my position at the moment, based on the most current science, and my opinion could change with better science, is that postbiotics are probably our best way to do this at the moment. So postbiotics and prebiotics are our friend. So that's your daily postbiotic and prebiotics to help with the gut function. And you've got digestive enzymes. Like I said, the horse is very, very, they need to do a lot of their enzymatic digestion in the foregut because afterwards it's basically just carbohydrate digestion. And we've got these horses that we want on grain-free diets. So if you look at a lot of the products that are available in the States at the moment, a lot of them use the benefits of beta-glucans. And this could be an entire lecture in itself. Beta-glucans help modulate the immune system and help repair and support the gut wall. Beta-glucans are in the cell wall of yeasts, grains. They're one of 3 carbohydrates that make up cell walls. Instead of supplementing those, my position is we make the horse able to pull those out of the cell wall more effectively. So we are just enhancing their digestive process rather than putting stuff in there to have an effect. We don't need to put beta-glucans in. We can just make them able to effectively use beta-glucans. Beta-glucanase, that's something that's in this. This is also, when you put ingredients in that are designed to do something and have a purpose, you start to see the benefits when they're science-based. There's none of this, let's just throw a bit of this, throw a bit of that, which happens all over the world with humans, with horses, with dogs, with cats. There's a lot of it. But I feel really comfortable using something that's based on science. So we've got that daily support that's going to help them resist those weird changes to the day that we can't control and help them to cope with the stressors that we inflict on them. And then in periods of acute stress, like diet changes, travel, even scoping them. I've had horses that when you scope a horse, you will usually keep them off food for 6 to 12 hours before, which within 4 hours, the horse's gut starts digesting itself. So the night before, we'll often give these horses a dose of stress paste, which is basically like a syringe of paste. And we've looked at the ulcers the next day and had to spray the pectins in the stress paste off of these ulcers because they've protected them so well, even that far down the track, which is pretty remarkable. I say, 4 hours till they start digesting, and we're going to keep them off food for 6 to 12 hours. And a lot of horses will have low-grade ulcers on a scope. Most horses will. How many of those are because we kept them off food for 6 to 12 hours before? I don't know the answer to that. Yeah. But that's another place where you've got, what else do you use? I don't have another answer. I use stress paste. You've got some clay-based pastes, like your bentonite-based pastes, which can be really helpful if you need to bind something. But the problem that I have with those is they bind everything indiscriminately. So if there's something in there, you can't really suspend anything in bentonites or whatnot that are beneficial because it holds onto them. So it is really hard to find something that you can use in these situations. And that's why I think that stress paste has been so popular, is because, like, it's in a lot of vet hospitals. It is everywhere. You come to a competition in Australia, and honestly, it is everywhere because there isn't really something that does the same thing. It's going to bolster your B vitamins, what we were talking about before. Your B vitamins are heavily linked to behavior. And I will talk about B vitamins a bit later in this, but because they're very highly linked to hooves. But we've got these two ingredients that we can use now that we can give them daily, I guess, metronomic support. At morning and night, they get this. Morning and night, they get this. This is going to support them. You put things like mycotoxin binders in there. Well, mycotoxins, we'll have to do another podcast on this because mycotoxins are a massive area of concern. Massive area of concern. But these are all the things that contribute to the horse's health. And a mycotoxin can be a stressor for a horse. Coming back again, I'm rambling. But stress. So on periods of stress, changes in diet, changes in hay, medication, sedation, getting their feet done if they're a stressy horse, overhandling, high work, hot days. Interestingly, when you see a horse that's tucked up or houndy in their appearance after they've done a lot of work or it's a hot day, that's because horses will divert the water from their gastrointestinal cells to their skin to help them cool down. So they are pulling, and especially when they're not eating, they don't need those cells to be turgid and full of water. So they get this sucked up appearance. Then when we rehydrate them and cool them down, they come back out again. We go, oh, they've gained weight again. No, they've pulled all the water away. And water is obviously really important. So betaine is an ingredient that's in stress paste, and it's probably the strongest osmolyte in the body of a horse. So its job is to hold water within cells. So you can take two horses. In my experience, I could have taken two horses or the same horse and taken it to a competition without stress paste and taken a photo, and taken it to a competition with stress paste and taken a photo. And I can almost guarantee you that the flank fill is better in my horse with stress paste. I've got to be careful not to make a claim there, but that's what I've noticed as a vet and a competition rider and someone who's finally attuned to horses. So all these little effects of stress, can you see how it's not about making the horse quiet, but the summative effect of controlling all of these stressors is then going to have the horse feeling better and able to perform. And I don't have another answer for you for how we can rapidly help them in acute times of stress. And that's why stress paste has been so popular. We've changed the way that people are thinking about stress with it. So daily support with digestive HP and times of acute stress with stress paste, I want to bet my bottom dollar that you will see significant improvements in a horse's ability to cope with stress and the signs you see, which then improves every aspect of their life with those. I've been working with these products as a vet for what we've been probably 7 years working through this process and helping with the design of these products. I've got a massive sample size in my head to make these comments off, but I really believe it. So then we come back to making your diet and management changes. If you do those and supplement the horse's ability to cope with stress, you are in the top 0.01% of the world in horse management straight away. I believe that. I believe that. And you can tell I believe it because I'm rambling on about it because I'm so extremely passionate about it, because I've seen horses die of what I would call the major diagnosis. They're stressed.
Yeah.
Colic, unless it's a physical, an epiploic entrapment or a nephrosplenic entrapment, even an intussusception, which is more about not feeding the horse. But the physiological colics that we see horses die of are generally directly related to a poor capacity to cope with the stress that they're facing. You know how you'll see, I don't want to put any blame on any owners that have experienced colic. It's a terrible thing. And some horses will experience it no matter what we do. But I cannot help but make the correlation that people who have a very strong focus on limiting stress in their horse, making sure their diet is perfect and supplementing the horses, not necessarily with the products I mentioned, but supplementing them in some way to help to support their gut, have a lower incidence of not only fatal colics, but colics in general. I believe that. I really believe that.
Yeah, and honestly, like a lot of what you were saying, especially about the ingredients, I've heard because I will say that a lot of my nutrition information has come from Dr. Kellen because, you know, the Hoof Care organization that I'm certified with and that I'm a mentor for, we have to take courses. And one of those options for courses is with Dr. Kellen. And, you know, she's talked about betaine and, like throughout summer months and hydration. She's talked about beta glucans. She's talked about, actually, I'm going to misquote this, so I probably shouldn't even say this is exactly what she said, but I know that she's talked about probiotics and not using them all the time. So this is information that kind of like, backs up everything that I've heard. And it's really interesting and awesome that there are products that are, you know, kind of taking that that path in like obviously science-based approach. So that's really, really cool. And I don't really have any like I guess I'm trying to think of where I was going with that, but just kind of like agreeing with you. And
I accidentally turned this into a bit of a lecture rather than a conversation. But what you're saying there is, I think what I started with, it's really complicated, but really simple. The people that are like, you know, I think about this 24/7, and Dr. Talon probably is the same. You know, like when you're thinking about it all the time, the people that are looking at these variables constantly, we all independently seem to come to the same key conclusions, no matter what it is. And that's because when we come back, it's really hard to study horses. It's really hard to do clinical trials or anything like that in supplements. Almost no one does it. But I want to tell you about the power of when we talk about supplements, how do I choose a supplement for my horse? I'm not just going to say Poseidon Animal Health products, but social proof is really great. And that's coming from a vet, you know. When you say social proof, when you see lots and lots of testimonials, and I'll make a note on that in a minute, and people are having success, I think that is actually just a compilation of case studies, uncontrolled case studies, but it's longitudinal research that's uncontrolled. But if no one is incentivizing people to give those testimonials and it's off their own accord, I would always consider testimonials as good evidence to support a product if there is no incentive to those people then doing it. And first and foremost, I'm a horse person, you know, and I don't want to spend money where I don't have to. Right. I want one supplement that will do the job of them all. That's my ideal. Poseidon was really actually, you know, extremely lucky about 8 years ago. They produced the product called Digestive EQ in Australia, which was the early iteration of Digestive HP. And it is the reason I believe that Australia is so good on gut health, because it changed the conversation. And there were lots of vets that went, there's no way this works. It just, you know, you're making too many promises here. But testimonials kept flowing in. And so there was a professor, Professor Andrew Dart at Sydney University, one of the most prestigious universities in the world. And for those that don't know, when we refer to anyone as a professor, at least in the system that I'm used to, an associate professor is a national expert. A professor is the title professor, not the occupation. The title being given a professor, it means you're a world expert. So this professor, I should be a bit more respectful there, using my Australianisms, is a world expert in horses. And he went, I'm not just going to sit here and be skeptical about this. I'm going to do my own study. So he did his own independent trials with it. And I'll have to send these through to you, Alicia. They'll blow you away. The horses that were receiving the product, they more or less were tracking weight. So they fed this particular group of horses a certain way. I'm misquoting. I haven't read them quite a while. Fed these horses a particular way, and then fed them exactly the same, changed nothing else, but added in Digestive EQ, which is, you know, the early equivalent of the Digestive HP that's available in the States. And the results were not only clinically significant, they were statistically significant as far as I understand, which is pretty cool just to say that is actually, there has been independent research done. because usually that's only in drugs, because people want to invest in drugs because they'll make them lots and lots of money if they can prove that they work. Proving that drugs don't work, no one will ever fund that. No one will ever fund me on a study to say that we should be giving them that result all the time. I don't think that they will, unless I can get research grants and whatnot, but no true funding in the way that drug companies get funding for their medications. So I don't want to discredit research, but keep in mind this is coming from a vet who's worked in the research space, using all of these sources of primary evidence and whatnot to make judicious decisions with everything we do in horses, but including supplements, is really, really important. I see it all the time, not just with Poseidon supplements, but all supplements. People come into the comments and say, where's the peer-reviewed research? Where's this, blah, 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 blah. And I really appreciate people doing that. They are being judicious and they are being skeptical, but it's not the only valuable piece of information that you can have. And we have, there is research behind these products. So it's not just that, there's no research behind these, but still buy them. No, we've got it. There's a lot of people that don't, but there are a lot of products that don't have research that I use in my animals, and I know that they work, and that's sometimes enough. So I guess putting your thinking hard on as a horse owner and trusting your gut, maybe that can be the title of the episode, and making decisions based on outcomes and other people's successes. So I don't know if you saw, I made a comment on one of the forums the other day on Facebook about how I use information as a vet, and I use the three-legged stool model. Did you see me talking about that?
I don't think so.
Okay, you'll love this, hopefully. Sorry, that's probably an Australianism to tell someone that they love thing, but I'm quintessentially Australian. I'm very casual about everything, even being a medical professional, but that's how I exist. So the three-legged stool model for me is, one leg is research and what we can read in books. It's important. If you lose that leg, the stool falls. Then you've got another leg that is your own experience. Every horse that I shoe, every horse that I scope, every diet that I make. And, I'm very, very, very fortunate to be working on some of the top performance horses in the world that are going on planes. Like that is a large portion of my job. They're going on planes very regularly and managing the stress in these horses. So every time I work with one of these horses, I get a little bit better at it. And that's not to say I'm not good at it to start with. Like that's not how we exist in the world. You're always learning, right? But we always get a little bit better, and that leg gets a bit stronger. It's less likely to fall. And then the third leg is probably the most important, really, is other people's experiences. That's anecdotal evidence. So if I see that Alicia's put a shoe on a horse and she's put on, I don't know, a hospital plate with nothing underneath it on a horse that's got signs of navicular, and the horse got worse, I'm less likely to then do that in the future. Or I'll go and ask her, hey, what do you think about this? What did you learn? What were your experiences? What did you see? That's extremely valuable. Extremely valuable. That forms our pattern recognition. So we've got these three legs of the stool that if we sit on top of that and use all of them and sometimes shift the weight towards one side and shift towards the other, in any situation, we can come up with a logical answer. So I encourage everyone listening to sort of use that model. Don't be too against non-peer-reviewed research in something that's not really developed in a lab. So I guess I'm getting on my soapbox there a bit, but and I'm probably more exposed to keyboard warriors on Facebook that want to take everything away from people trying to do the right thing. Is just trust yourself, trust other people's experience, and trust what information is out there. There's a lot of good information out there, and the way you can sift through it is, I trained for 6 years at university, more or less, to filter through research. That's what vets get primarily. We can't know everything about every animal, but if they can teach us to filter through the truth and what's false, then we can come across anything and find information on it, especially in this world of access to information that we have. So if everyone takes a bit of that, in their stride and says, how can I find the right information here? Every single time you do it, you get a little bit better. It's really, really cool. And that's because you're developing your own personal experience and seeing other personal experiences to be more judicious in which textbook data, the other leg, that you use. It's a bit cyclic here, but can you see what I'm getting at? This whole, everything I've really said today is actually really, really simple principles. You've just got to slow down, use a bit of pattern recognition, use what you know. We're horse people, we know horses. You know, we like hoof care professionals, you spend a lot of time underneath horses. You know them. Why should a paper tell you what you can and can't use? And that's from someone who writes papers. They're one leg of the stool. And if I could do an entire lecture just on that. And I've digressed a bit here, haven't I?
And honestly, I feel like we could talk about this forever. And I didn't know if you had some kind of like last minute advice to owners who might be dealing with, this topic of like wanting to improve their horse's gut. Or I mean, really any of the listeners, if there's any kind of like tips or advice you kind of want to like send home with them.
So I'll give you some from, I'll try and work it back into hooves, because that's what we're all here for primarily, is that if you understand the horse's ability to produce energy, it's from the production and slow production of volatile fatty acids in the hindgut. The bacteria produce those, and that makes up 80% of the energy that the horse has. If you have a horse that gives you a lot, or is spooky to start with, is hot to start with, is naughty to start with, and you have to lump them down, but once you do that, you have no energy. The horse that can't finish the cross-country course, it's because we're relying on this high GI, quick burst energy, rather than this lovely slow-release energy that the horse has been designed specifically to be able to do, slowly break down fibers and give you this slow source of really great energy. That's volatile fatty acid production. When you get starchy sources, or sugars, molasses. Molasses has a place in horses. It's very slim. It's basically, if they won't eat, that's when molasses comes in. That's about the only place that I ever use molasses. It's quite a big stressor. But if we're feeding these high grain, high cereal grain diets, that are super starchy, unprocessed corn is a big one. They're really, really easy, especially after a bit of enzymatic digestion, for horses to use those simple sugars and make volatile acids really, really, really fast, right? And when we talk about volatile fatty acids, the key word there is acids. We get this massive acid production in the hindgut with bacteria and fungi and viruses and all of these massive microbiota that are allowing this horse to function. They're controlling its brain. They're producing hormones that communicate with the brain. It's this mind control aspect of the gut microbiome. People who have depression generally have a less healthy microbiome. This is how strong the link is. They want to live in an environment that's around that pH 8 to 9 alkalinity, and we take it down to 6 really rapidly, or 5, 7, anything lower. They all die, and we're going to shift towards acidophiles, bacteria and yeasts and viruses that love acid, and the whole postbiotic production system, what they're producing, changes. Why is this important? Because we expect horses to perform. That's one. Because we control it, because we are influencing this directly with what they eat. When bacteria can't break down what we're putting in there because it's not educated to break down that stuff, that's your rapid changes of diet. It either won't be digested, or it'll be digested in the incorrect way and throw everything out. So a key takeaway, any change you make to the horse's diet, make it slowly and systematically and planned over about 2 weeks. But frequent changes to the horse's diet that are small and are relative to what they're exposed to are excellent. If your horse works a bit harder, you can give it a little bit more hay. If it's a cold day, give it a little bit more hay. If they're having a week off, drop it back a little. You can make these little changes. You don't need to be giving them so much all the time, because that's when we see horses that go, he rears, he bucks, he does this. It's because you're giving them more than they need, because people are too scared to change. They go the other way. So you can make changes to their diet. Feel confident making small changes to their diet. You can do that every single day. Don't change the ingredients. Don't change things by, say, more than a random figure might be 5 or 10%. But those small changes are really great. So focus in the diet on forage-based diets that are low in sugar, low in starch, and pasture brings in another component, which are your fructans, which are grass sugars, but we won't talk about those because we're just talking about what we can feed. So sugar beet pulp, unmolasses, in my opinion, the single best things you can feed a horse for 99% of conditions, they are suitable. Beet pulp is a byproduct of the sugar industry. It's not sugar beet pulp because it's got a lot of sugar. It had sugar in it, but they've stripped it out. And if you know anything about big companies, they don't want to lose any of the valuable resource, and sugar is a valuable resource, which is good for us because we can trust that most sugar beet pulp is going to be quite low in sugar, like very, very low, lamitic safe. It can be quite high in iron. I think that becomes a very nitty-gritty conversation. A lot of our soils are already too high in iron. I think the benefits outweigh any risks with beet pulp, and I would confidently put, unless they have an allergy maybe, but confidently put I should put a disclaimer in here, don't put on every horse on this, but really if it was my horse, no matter what horse I bought, no matter where I was, I would feel confident putting sugar beet pulp into their diet. Unmolasses, micronized is the best. We have different forms over here. I have nothing to do with this company, but we use a product called Speedy Beet over here.
And we have it here too.
Yeah, so that's the one that, like, I know that one. There's probably others over there, but that's one that I can confidently recommend. I fed it for more than a decade, and touch wood, I've had dozens and dozens and dozens of my own horses, and I shouldn't say this out loud. It's like cursing yourself. I've never, ever had a horse truly colic. Mild colic signs at best from travel, but never had a horse colic, and I've pretty much always fed beet pulp. It is probably the most effective prebiotic for horses' microbiome, which means they can use it really well to make those volatile fatty acids, and it also it fertilizes them, makes them really good at doing their job. We know this is known stuff. So that's something that I would include. It can be cost prohibitive, but honestly, if you put half a cup into your horse's diet, you will have benefits to their microbiome. Well, I think we'll have to have another catch up for this for sure.
Yeah, I would love to.
These horses, I'll say pop the hay in a bag with small holes. There's been some concerns about horses damaging their teeth from slow feeder nets. That's been recently not disproven, because we never seek to prove things with scientific research. We just support things. So the finding that horses will damage their teeth from long-term use of slow feed hay nets is lacking in support given recent research. It used to be a supported theory, but the research actually doesn't support that. So I have no problem with horses having their feed from slow feeder hay nets. And there's also research around the intake. The intake per day actually doesn't change with slow feeder hay nets, just the rate. So, which can get quite confusing, but say you give a horse one biscuit of alfalfa hay and they eat it in 15 minutes, that is not ideal, but that's sort of how fast they can eat. Whereas we can give them maybe 10 biscuits of alfalfa hay that's been soaked in the slow feeder hay net, and they will always have the same capacity to eat hay throughout the day. They can only take so many bites in the day. So it's really, really interesting. They can be eating all the time, and even if we say gave them 5 biscuits on the ground, I don't recommend feeding off the ground, but 5 biscuits or 5 flakes off the ground, they'll eat them quite fast. And we might think, oh, but she doesn't have food all day. She's not eating much. She doesn't get a lot of food. But then we'll see a horse that gets the exact same amount with a slow feed and then says, oh, he's eating all the time. He must be so fat. The total intake doesn't change. The rate changes, and a slow, constant feed of energy to the hinder is good for a horse's metabolism. Bursts, peaks, and troughs, ups in glucose means peaks in insulin. We don't want any of that. So I guess, what am I saying here? Beet pulp is good to include. Slow consumption of constant access to feed is ideal. So I think, Alicia, we might have to talk about, in another episode, I'd love to talk about feeding horses for weight loss and refeeding horses that have been starved, because the metabolism behind that is extremely interesting, and I love to talk about it. But it's important that you don't starve horses ever for any reason, even if they are fat, or even if they have a metabolic cause laminitis. We can't starve them because they're designed to have food going through them all the time. It takes 4 days for them to digest, or up to. If we have a big gap in there that's full of gas, that's when you start to get twists and colics and whatnot. Constant access to feed. They need to have a level blood sugar. So that's the big advice there. I haven't even got to feet, but thinking about the gut as an immune organ and thinking about it as a place that is a factory of production of everything that the horse needs, apart from, there are some essential things like ALA, which is an omega-3, but that's just an example. These essential things that they need to get from grass usually, but most things they can produce themselves. And I'm going to finish with a little bit of a pearl of wisdom here that'll make you think about gut health in between our next conversation about feet. Where this now, I feel like I've laid the foundations for talking about feet a bit here, is that horses don't need a lot of biotin in their diet. We know that biotin is a key player in the Krebs cycle or the citric acid cycle. It's involved in energy production. It's involved in the strength of connective tissue, full stop. It's really important. I think that, I don't think that anyone's going to disagree. Any hoof care professional in the world will disagree that biotin is important in the production of healthy hooves. Why do we see horses with horrible hooves when they have hindgut problems? And here's this wonderful answer I have for you: is the horse's microbiome produces almost all of its B vitamins. Vitamin B7 is also known as biotin. The horse, maybe a 600 kilo horse, might need 7.5 grams biotin a day to function and do all the things that we need them to do. Then you imagine a horse with brittle feet and look at it and think, that horse has brittle feet. Biotin's just one ingredient there, but is their hindgut working properly? Because they should have the ingredients that they need to build healthy feet with no supplementation. Horses do not need biotin supplementation. If you look at what I feed my horses, I feed the biotin. Why? It's cheap, safe, it's a fail-safe, and it seems to work. The more you give to a certain degree, your benefits increase. But if I have anything happen to my horses, their feet are so important to me that if they have a big stress event and they can't produce their own biotin anymore, I want them to be covered. The other thing is, it can take up to 12 months from when you start a perfect diet and perfect management for the horse's gut to heal and recover to a level that they have a truly functional microbiome. So with horses that have a poor hoof condition, and that is associated with seemingly poor gut health, I'll generally recommend including biotin in the diet for at least 12 months until we can confidently say that the hindgut is working well enough to produce the biotin that they need to create healthy tissue. So my horses, it's all the connective tissue. It's part of the citric acid cycle. That's how we make energy, right? So everything that's stuck together in the body involves biotin. So does this make their risk of tendon injury? Does it lower? Does this make their risk of eye injury, skin injury? Does it make it lower? I don't know. But it makes sense to me that we support the hindgut to produce these key ingredients to make healthy tissues all the time, even if the answer is just in case because the research isn't there yet. Horses with healthy hindguts are shiny. They don't get sick. They grow beautiful coats. They grow beautiful tails. They are happy, bright horses. B vitamins. People think, oh no, but they're B vitamins. They're just vitamins, right? Oh, but so and so's. Sorry, that may be an Australianism. This person's baby has spina bifida because mum didn't have high enough folate intake while they were in pregnancy. Folate is a B vitamin. Niacin is a B vitamin. Thiamine is a B vitamin. If a cow is deficient in thiamine, they get polioencephalomalacia. They go nuts. These are B vitamins, and we don't need to put them in. We don't need to put them in because the horse can make them, but we feed them so anthropomorphically or so human-centric that we stop their ability to do that. We are doing it to them. When you have horses that have an unhealthy hindgut and have brittle feet, we've actually done that. And horses, okay, I should probably finish this conversation, but I will truly finish with horses give us so much. We expect so much from horses. I know personally they not only give me my career, but my whole life is built around horses. My passion is riding horses. My passion is being around horses. When I'm around horses, I'm happy. When my friends are around horses, I'm happy. I've made these connections in my life. Look, the connection that you and I have. I've made friends overseas. Through horses, they've given me so much in my life, and we need to keep up and learn more about them so that we don't take away from theirs to have them in ours. It's not fair, and they've given us so much, and we owe them so much. And a lot of the things we see, 80% of the things that I've seen horses for, are for husbandry that's not quite as good as it could be yet. But I want to look at that in a positive sense and say that it's not quite as good as it could be yet. I can't do that, or I can't feed like that, or I don't feed like that, or I can't manage him that way. Change thinking to up until now. Up until now, I couldn't do that. But, every time we listen to a podcast, I'm hoping that some people have learned some things from today. Up until now, I didn't know that horses' hindguts produce biotin. I'm going to think about that. There's this whole up until now model. That's how we learn with horses. Pattern recognition, research, our experience, other people's experience, put the clinical picture together, and always just be aiming to do better. To do better because we owe it to the horses, because we love them and they're amazing creatures. And they give us so much. It's time we start giving back.
Absolutely. Yeah. Thank you so much. And I think this is, such a great conversation. And obviously there's so much more to even discuss. So I would love to, pick a time to maybe expand on it. But I think this is a good amount to digest. And I really appreciate you being willing to chat with me about this.
Oh, it's absolutely my pleasure. As I said, it's my biggest passion, and I love to share. I've worked hard to try and discern myself what good information is and what bad information is, and I feel I'm equipped to do so. I still here and there struggle with bits of information, and I consider myself a little bit of an expert in this space, so I can only imagine what the rest of the community feels like that maybe hasn't had the luxury of the education that I've been really privileged to have, and the mentors in my life that I've had that have helped me to learn this. So if I can share that in any way, I feel very privileged to be able to do so, and a privilege to be here, and privileged that everyone has taken the time who is listening to listen to what I have to say and feel the passion that it comes from, and the genuine intent that I have here in helping not only the horse that's in front of me as a vet. I love doing that. I love to see the change, but I know that the capacity that knowledge and education has to improve the lives of animals is immense. So I'm hoping, that this conversation that we've had today is really important. It could have changed the lives of thousands of horses. Who knows? But that's why I get up every day. That's why I've shown up today. I really think that we have a power to make difference through critical thinking and sharing our own knowledge and experiences, and looking at what's available to help our horses if we can't do things perfectly.
Yeah, absolutely. Awesome.
Wonderful to meet you.
All right. Have a good rest of your day. I guess it's day there. Yeah.
Yep.
All right.
I've got to fight now.
Bye.
Bye.
I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.